Hello, I'm Dr. Bill Inman. So most of you know me. I'm the frequency-specific low-level laser therapy guy. I've developed the last 20 years. I've developed over 1,800 protocols and about 23,000 different frequencies specifically for disease conditions we see in mammalian species, dog, cat, horse, and human. This is a mini lecture on gastrointestinal disease in general, essentially, and the etiology of that condition. If you're over 40, the chances that you have a related gastrointestinal disease condition, or had one, or going to have one, is about 100%. So it's important that you probably listen to what we have to say. The important thing to understand is that conditions as we age, dog, cat, horse, and human, essentially, is breakdown of tissues. We eventually break down enough tissues to where we run out of gas and die. However, that's consideration of lack of blood supply to the various tissues. And this is kind of important because there's a number of different medications and therapies out there that are designed to try to increase the blood supply to the various tissues. Nitric oxide is one of them. You can get it from super beets, that type of thing. However, the effects last for a couple hours. And what you're trying to do is you're trying to make sure that you have an ample amount, if not a perfect amount, normal amount of blood supply to all the tissues of the organs of the body. As we age, essentially what happens is we end up with injury along the spinal cord and also toxins and other stresses in our body that actually elevate the sympathetic tonus, the stress in our life. Stress from the adrenals and stress, physiological stress, increases the sympathetic tonus and decreases the parasympathetic tonus. Now, a real quick background of sympathetic and parasympathetic. We move our arms, which is a voluntary motion, but the autonomic nervous system basically fires off things and functions in the body to try to keep things going and maintain functions of those particular tissues and organs based on non-voluntary motion. The normal function of the sympathetic and parasympathetic, the autonomic nervous system is sympathetic and parasympathetic. Ordinarily, in a healthy creature, the parasympathetic is very, very high, and that basically stimulates the body's organ systems and blood supplies to the systems actually to function in a homeostatic mechanism. The sympathetic is very low and is basically sitting as a resort in case there's a disaster. So if you're being chased by a saber-toothed tiger, there's really no reason for you to put a bunch of blood into your gut to deaminate protein and digest anything. You need to put blood into your lungs, cardiovascular system, and also muscles to run away from the saber-toothed tiger. So during that short period of time, the sympathetic comes way up, but that forces the parasympathetic to go way down. And then when the tiger walks away, essentially you calm back down and you go back to the normal homeostatic mechanism. So parasympathetic high, sympathetic very low is the normal state of functionality. It's important to understand that the sympathetic side of this equation, the sympathetic and parasympathetic share a certain amount of energy. One can't be high with the other one high. They can't be like this. They go like this. Okay? So the sympathetic is the one that's actually in control, and so it basically makes the parasympathetic do what it wants to do. Now, as far as the parasympathetic is concerned, you can lose 60% of the total functionality. You'd be down at 40% before you start to see clinical disease such as gastroenteritis or acid reflux or chronic inflammatory bowel disease. Below 40% you have disease, above 40% you don't. So if you lost 50% of your parasympathetic tonus, essentially, you're still happy and healthy, you're not showing clinical signs. And this is kind of interesting because when we have a condition where we have elevated amounts of stress in our environment, and also because of injury along our spinal cord, increasing the sympathetic tonus in the area of the of the sympathetic nerve trunk, which is T1 to about L4, what that does is that elevates the sympathetic tonus a little bit. Now what that'll do is bring down the parasympathetic tonus a little bit. But if it doesn't drop below 40%, we don't have disease. It may be down at 50%, whereas the other one is about at 50%, and we're just sitting right here potentially able to have a disease process. And so we're compromising the blood supply continually to those tissues. Compromised blood supply to to gastric tissue, for instance, will eventually cause the accumulation of the byproducts of metabolism, reactive oxygenation species. In other words, the byproducts of metabolism to accumulate in the tissue and break the tissue down. It'll break down the epithelial tissue on the inside of the gut, causing the gut to leak. Therefore, we end up with chronic inflammatory bowel disease. We end up with gastroenteritis. We end up with all kinds of problems and also allergy. The body leaks protein straight into the bloodstream and doesn't have a chance to metabolize it. So we see a lot of conditions associated with this elevated sympathetic tonus, and it doesn't have to elevate to a high level. This is what happens when you're chased by a saber-toothed tiger. This is what happens when you're just stressed out all the time. like my good lady wife, God bless her. And so she's stressed out all the time, and so her sympathetic is high, unfortunately, and her parasympathetic is barely within the normal range, above 50%. And because of that, she'll be prone to all kinds of conditions that are gastroenteritis and other types of conditions. It'll affect her liver, her pancreas. It'll affect her gallbladder, her digestion, essentially, and lots of other things. It'll also cause her to accumulate a bunch of body fat. The body does that. And also it'll predispose her to type 2 diabetes, which is another lecture altogether, and we'll talk about that in another situation. Now, the important thing about that is the body, the medical conditions, pharmacology have basically come up with neurotransmitters to fake out the autonomic nervous system with neurotransmitters that are either parasympatholytic or parasympathomimetic, sympatholytic or sympathomimetic. In other words, they stimulate the sympathetic or block the sympathetic. They stimulate the parasympathetic or block the parasympathetic. Prilosec's a classic example of that for heartburn, for instance. Essentially, it blocks the function of that particular gland in the stomach to produce gastric acid. And so what these chemicals do is for a couple hours, they give you an effect. However, they have to be taken continually, and after a short period of time, like a couple of weeks, they're not effective anymore. Although we can continue to take it and we get short-term effects essentially for benefit, but we're not curing anything. And it's our goal with the laser to actually reset the autonomic nervous system, and it's not difficult. We utilize now, we've started using a different laser than this, and now we've got one that's like hundreds of times more effective. And what we want to do is we'll want to, for most cases, and we do this almost very, very commonly, we'll want to overstimulate the sympathetic nervous system. It's up like this, and we're going to laser it. Let me see if I can get this to work. We're going to want to laser it along the back here, essentially. Let's suggest we're taking care of this animal, human being. And we're going to do this for about 60 seconds. And what we're doing is we're overstimulating the sympathetic nervous system. And here's the weird thing about this. Since the sympathetic is the dominant of the sympathetic parasympathetic, what it does is it raises the sympathetic level up at about 28 to 38 seconds, 28 to 34 seconds. It, boom, drops to its normal level and reestablishes the parasympathetic. We call this a sympathetic overstimulation, and it's one of the most valuable things I can teach you because all intents and purposes, about 9 out of 10, if not 95% of all the animals and people you're going to treat are going to benefit from a sympathetic overstim because in this day and age we have elevated sympathetic tonus all the time, and it holds these chronic conditions in place. Now, this laser, for instance, basically has in excess of 1,800 different protocols, and those protocols have anywhere from 12 to 16 different frequencies per protocol. Of those protocols, 900 human, 900 animal, almost half of them carry the sympathetic overstim protocol for either animal or human being. And basically that's part of our healing cycle. And one of the reasons that this device is so effective is because it has the ability to reset that sympathetic parasympathetic back to its normal inherent level. Where sympathetic's low, parasympathetic's high. Now, I didn't learn this. I was taught this by Dr. Richard Amy in about 2003, and we started applying it to clinical disease with amazing results. We have over 600 of these things in the field, and we've never had one return. All we get is amazing, amazing, amazing results from people that call up that have this device that are able to take care of things they've never been able to take care of. And I tell you, the reason for that is because it's frequency specific. We go in there with this easy protocol. For about a week, we'll treat it like every other day, and we'll reset the autonomic nervous system and basically allow us to handle things like chronic inflammation of the gut, a gastric dilatation, torsion, a number of other conditions that we see in the GI tract, such as pylorospasm, esophageal achalasia, and gastric acid reflux, essentially. I can go on for hours about what it is we treat. Also for liver dysfunction. Lack of blood supply of the liver will cause hepatic failure. Kidney dysfunction, gastrointestinal and cardiovascular problems can also be treated and are treated with this approach of sympathetic overstimulation. There are some cases, about 5%, that require for us to stimulate the parasympathetic system. And we talk about that in another lecture. But nonetheless, the value of this instrument, if I could basically hand this to you and say, okay, the thing costs $7,600 and it only has one frequency set in it, and that's for parasympathetic overstimulation. I'm sorry, sympathetic overstimulation. Hand it to you. You would be able to use this and retire with this instrument. It's that effective for so many different disease conditions. However, there are 1,800 other protocols specifically for that. Very commonly we'll use a specific frequency for like gastric dilatation, torsion, or gastric reflux essentially, we'll use that. It'll have the frequency in it for sympathetic overstimulation, followed by parasympathetic stimulation. And so that's how we handle these chronic conditions and take care of these conditions, the dog, cat, horse, and the human. We've been incredibly successful with this instrument. And if you have any questions, I would recommend that you give me a call, and I'll be more than happy to talk to you in depth. But if you have one of these instruments, and you got it from me, you have the sympathetic